Are you struggling with that relentless sciatica leg pain and you've tried everything and the pain still lingers? You're not alone. Most treatments barely scratch the surface or leave you feeling like your pain isn't severe enough for real solutions. But what if there was a proven 5-step protocol that's helped thousands use to finally get long-lasting relief? It's called the Back to Life method, and it's specifically designed to tackle sciatica at the source, fast, safely, and without guesswork. Curious how it works? Stick around to discover why this method could be the game changer you've been looking for. Hi, I'm Dr. Ruminder Birk, a chiropractor in Woodbridge, Ontario, Canada. We have helped thousands of patients recover from spinal conditions such as disc bulges, herniations, degeneration, lumbar stenosis, sciatica, and radiculopathy. We use non-surgical decompression as the cornerstone of our unique and proven Back to Life method. Be sure to hit that subscribe button if you want do-it-yourself tips, strategies, and exercises that will help you relieve and manage your back and leg pain at home. Plus, you will discover which therapies are the best for treating disc bulges, disc herniations, and other spinal degenerative conditions. I upload a new video every week. In addition to that, I wrote a book called Back to Life. Imagine getting your life back while getting your health back. You can get a free copy at the link in the pinned comment below. The sciatic nerve is the longest nerve in the body, originating from L4, L5, S1, S2, S3 spinal nerve roots. This nerve runs from the lower back through the buttocks, down each leg. And when any of these nerve roots or the sciatic nerve itself becomes irritated or compressed, it can cause intense pain, numbness, tingling, weakness in the lower back, legs, and feet, often making even simple movements difficult. Sciatica is particularly painful and disabling because it directly impacts the nerves that control sensation and movement in the lower body. The pain can be sharp, shooting, or burning, often radiating from the lower back into the legs, sometimes making it hard to walk, sit, or even stand comfortably. This pain often comes from multiple underlying issues affecting different tissues and structures. Because of this complexity, sciatica usually requires a multimodal treatment approach to fully address the various causes. A single therapy, whether medication, injections, or a couple of exercises, typically isn't enough to provide lasting relief. These treatments may target only one aspect of the problem, leading to incomplete results or short-term relief. That's where the Back to Life method comes in. This method uses a comprehensive multimodal approach with 5 proven steps designed to work in synergy, addressing and assessing all the tissues and structures involved in sciatica, whether the cause is degenerative arthritis, compressing L4, L5 nerve root, a disc bulge or a disc herniation, spinal misalignments, stenosis, sacrum imbalances, or muscle tightness like a piriformis syndrome. The Back to Life method targets each of these tissues for complete and lasting relief. Often, sciatica is the result of several combined causes, and this method ensures that no stone is left unturned in finding and treating them. Let's dive into each step of the Back to Life method so that when you're seeking professional help, you can ensure none of these crucial steps are missed or overlooked. So the 5-step protocol, the first step is going to be on you. That is to take the step of book your consultation. Make that call now so we can get you started to getting back to life. The second step in the process is one of our wonderful consultation specialists is going to call you back to take a complete history and get the answers to why you have this problem. The story of how you got here depends on life and how many factors have been involved, whether it's a fall, whether it's an injury, whether it's work-related stresses, or general progressive problems. Sciatica always has a cause, and the history is going to give us all the answers to figure out how to correct those causes from the root. Now, at the end of this history consultation, we always tell our patients the most important thing is to understand what's there at the current problem now. So whether you have previous MRIs or x-rays, we're always going to send you for our own x-rays. So the x-rays are for me to look at to really see the degree of severity, how far this has degenerated, whether it's at your sciatica is coming from your disc bulges or actual arthritis. And that x-ray analysis is going to give us an answer of why and how this problem has progressed internally and how we can correct that problem, how many visits, putting together a specialized plan just for you. The x-rays are vital in understanding your cause. So now that I've taken the time to review your x-rays, I want you to see them. I want you to understand your condition. These x-rays are for me and for you to see the degree of severity, showing you normal, showing you where you are now, and how we're going to get you back to life. So with this care plan, we're going to cater to you. We're going to really put together how many visits, what specific order of treatments are going to be done, so you get the results that are long-term and permanent and not just temporary or none at all. So this is the way the care plan recommendation gets you there. And of course, last and most importantly, it's to get started, right? So we want you to get started, getting you back to life. Now that you have the answers of what it takes, what your problem is, the degree of severity, getting started, we're going to show you the back to life method, the 3 key components, and the order of treatment that gets you back to life. So part of our treatments, now that we're getting into actually how we correct this problem, when it comes to sciatica, the number one cause is going to be the alignment of the spine. In the x-rays, I've shown the patient what's going on with the spine and where the misalignments are, the subluxations that have led to the sciatica going down the leg. A couple of things that we always check on is, as we check the pelvis, correcting the spine, we're going to get into corrections by hand, by special tables that come up and down and realign the spine, or by hands-on with tools that get into correction of the sciatica from the cause with a chiropractic adjustment. So the keystone of this treatment protocol is going to be the spinal decompression tables. These are computerized tables that have exact programs to target your sciatica from the cause at the disc that's compressed. Decompression creates a negative pressure that, as it pulls over a sequence of pulls and relaxations, feels great to the patient, relaxing their spine, bypassing muscles, and getting that disc rehydrated again, getting to the cause of the sciatic nerve compression. Opening the spine from the cause leads to the nerves opening down the legs, provides a great amount of relief, long-term correction. Now the third component is the class 4 laser. So this is a low intensity laser. We wave that over the lower spine with the sciatic nerve roots. As that calms down inflammation, breaks up scar tissue, brings more blood flow, and helps regenerate cartilage and tissue, the laser is a powerful light that feels like a warm, soothing, warm light that gets in there and penetrates tissues and relaxes them. So as healing occurs faster with laser, patients find this very soothing right away when they start treatment for the sciatica nerve problem. So as we go through all these treatments, patients are going to be coming in consistently. We find those that come in over a program of care, most times 3 months, whether it's 2 to 3 times a week. And at the end, as we go through the process, we're going to take x-rays and confirm. So that gives me the answer and you the answer that the problem's been corrected, how much it's been corrected, and what you're going to do to keep it maintained. So always, anything that's been better, it's easier to maintain it than have it coming back. So as these patients go through care, the more they're doing at home with their stretches and exercises, this leads to long-term results of the sciatica relief. Now that you've learned about the Back to Life method and its proven 5-step multimodal approach, you can see why relying on just one type of treatment often isn't enough. This method targets the root causes of sciatica, combining therapies to work together for real, lasting relief. If you've been searching for a solution that addresses your pain from every angle, this could be the answer you've been looking for. We'd love to hear your thoughts. Drop a comment below with your questions or experiences. And if you found this video helpful, don't forget to like and share it with others who might benefit. Remember to subscribe to my channel now if you want do-it-yourself tips, strategies, and exercises that will help you relieve and manage your neck and back pain at home. The next video you need to watch is this one, where I guide you through the 4 best sciatica stretches for quick leg pain relief. These simple stretches can make a big difference. Go watch it now and start feeling better today.